This is the fraud, waste, and abuse training. Fraud is defined as an intentional or deliberate act to deprive another of property or money by deception or other unfair means. The ways in which fraud occurs are as unique as the individual perpetrators, their motives, and the situations they exploit. For the purposes of this training, fraud is intentionally submitting false information to the government, including situations in which you should have known the information was false, to get money or benefit. Waste is defined as practices that directly or indirectly result in unnecessary costs to federally funded programs, such as overusing services. Waste is generally not considered to be caused by criminally negligent actions, but rather by the misuse of resources. Abuse is defined as actions that may directly or indirectly result in unnecessary costs to the federally funded program. Abuse involves paying for items or services when there is no legal entitlement to that payment. The Office of the Inspector General's mission is to detect and root out fraud in federal healthcare programs, including Medicare and Medicaid. They help fight fraud, waste, and abuse by preventing, detecting, and deterring fraud, waste, and abuse, fostering sound financial stewardship and reduction of improper payments, holding wrongdoers accountable, and recovering misspent public funds. There are several reasons that the Office of Inspector General would audit, evaluate, or investigate, and those include fraudulent use of grant funds related to health and human service programs such as the Low Income Home Energy Assistance Program, TANF, Head Start. They would also investigate due to quality of care, ineffective program internal controls, IHS employee misconduct, Medicare and Medicaid fraud, prescription drug diversion, benefit enrollment fraud, and Tribal 638 program fraud. The False Claims Act allows the federal government to recover damages and penalties from entities that are involved with submitting false or fraudulent claims to the federal government, including Medicare and Medicaid. This act prohibits filing a claim that was not actually provided. The Civil Monetary Penalty Law. This law protects the government from improper conduct, including the submission of false claims related to health and human services, grant programs, federal contracts, or federal health care programs. The anti-kickback statute is a criminal law that prohibits the knowing and willful exchange, solicitation, or receipt of anything of value in an effort to influence, induce, or reward the referral of federal healthcare program business, including the referral for Medicare, Medicaid, or Indian Health Service items, and arranging for or recommending such items for services. The Stark Law prohibits physicians from referring patients to entities with which they have a financial connection. You can decrease the risk of fraud, waste, and abuse by understanding fraud, waste, and abuse, submitting accurate claims, accurate documentation, and accurate billing to Medicaid and Medicare. If you suspect or discover fraud, waste, and abuse, or you violated the law or program requirements, you would need to report that to your supervisor. If you do not feel comfortable reporting that to your supervisor, you can report it anonymously. The link is located here in the slide, or you can find the link on the intranet. All reports will be investigated. If the report is substantiated, the fraud, waste, and abuse policy steps will be completed. All information for this training came from the Office of Inspector General's website.